Michelle, good to have you on the program. Michelle, given that the Department of Health has not budgeted for the treatment of foreign nationals, what specific financial implications does this have for the healthcare system?
The system is extremely overburdened. Full stop. There are many cases where neighboring countries' doctors would refer patients to our state hospital facilities and then go back to neighboring countries. We believe when patients are treated in our hospitals that we are able to recoup the costs from that said government. We are in a very tight squeeze economically at the moment. The government at this stage is in a very big economic decline. You know, it's just not coping even with South African citizens because the budgets are cut year on year, even if there is no budget for foreign nationals. And I can assure you, no NHI at this stage is going to ratify this problem because we have to fix our hospitals first before we can even think of implementing NHI because our hospitals are not.
Yeah, guys, so it appears that the DA is trying to remind the government that South Africa cannot continue to be what I call a Father Christmas for Africans, especially from the perspective of health, because South Africa's budget is actually heavily constrained at the moment. And so the DA is actually trying to push for a sort of like a recoup from the government for treatment that actually given to foreigners who I think in the event of being referred to from their countries to receive treatment in South Africa, they end up returning back to their country without the payment really staying in South Africa. And so the DA wants the government to try to push for kind of like a restructuring, and especially this is from the health minister Motsoaledi at the moment, to try to restructure in a way that some of the money that is actually being used to treat the foreigners can actually be recouped within South Africa and help the budget of South Africa stay afloat for South Africans and cater for South Africans also. Let's listen to this DA MP really break down this really important aspect of South Africa's system, especially in the light of the NHI bill that is about to be rolled out by the government. And I'll be back for some really interesting, strange analysis on a report I found on the Daily Maverick on the disappearance of 428 million rand, which was set aside for the ordering and tender of oxygen plants by a ghost company.
Parliament's Health Committee wants the Department of Health to consider recouping money spent on treating foreign nationals at state facilities. DA Member of Parliament Michelle Clark has suggested the matter be raised in the South African development community for governments to carry the costs. While Michelle Clark joins me now to tell us more. Michelle, good to have you on the program this afternoon. Firstly, what is the rationale behind the Health Committee's call for the government to recoup costs which are spent on treating foreign nationals in state facilities?
Good afternoon and thank you for having me on your show. So, you know, when discussing this matter and considering the state healthcare is in and the massive burden we have in terms of trying to treat patients and giving quality healthcare, which has become a huge strain on public hospitals, number one, and number two, we are experiencing budget cuts year on year, which now increasingly is making it even more difficult in order to ensure that there's quality healthcare within public state facilities. And we read these horror stories every day. So the discussion was really around, you know, in terms of the Constitution, Section 27 of the Constitution, South Africa must provide every person with healthcare that comes to state hospitals, and we agree 100% with that. But what we do feel is that there are many cases where neighboring countries' doctors would refer patients to our state hospital facilities and then go back to neighboring countries. And we believe in the Health Committee during the discussion that there should be some discussion with the Minister and the President on a SADC forum to see if there is a process that can be implemented that when patients are treated in our hospitals, that we are able to recoup the costs from that said government. And that was the discussion at the Health Committee portfolio last week in terms of this issue.
Can you elaborate a bit more on how the treatment of foreign nationals is affecting the overall service delivery in South Africa's public health system?
Well, I think at this stage the system is extremely overburdened. Full stop. It's just not coping even with South African citizens as well. So, if there is a way that we could recuperate costs from neighboring countries in terms of our budget cuts that we are seeing in healthcare, that would immensely help the strain public healthcare hospitals are facing at the moment in terms of shortages of staff, shortages of equipment, infrastructure, and many more issues that we are faced with within state healthcare at the moment.
Michelle, given that the Department of Health has not budgeted for the treatment of foreign nationals, what specific financial implications does this have for the healthcare system?
Well, I think let's be frank, the budgets are cut year on year, even if there is no budget for foreign nationals, because the government at this stage is in a very big economic decline. We see this within the country at the moment, and of course, there are a lot of processes being put in place to try and recover the economic status of South Africa. But we are in a very tight squeeze economically at the moment. And, when we do not budget for specific items in terms of treatment, which in this case where and you feel very sorry for people that need healthcare and they're not able to afford it. So we must assist people. We can't not assist people, but there must be a way that government can go into discussions, and the minister and the president have those vetoed powers, and discuss at SADC how we would deal with this approach. So that is a concerning factor, because the huge budget cuts that we are seeing, and that hospitals are really not coping at the moment. And I can assure you, NHI at this stage is going to ratify this problem, because we have to fix our hospitals first before we can even think of implementing NHI, because our hospitals are not in line with the ideal clinic specifications in terms of NHI. At this stage, a very few percentage, is in line with that. So we need a mass budget in order to fix our hospitals first before we can even supply what we would like to say, not universal healthcare, but quality universal healthcare to everybody. So that is our concern, and we believe that the minister and the president should go into some form of negotiation with SADC. And, it is a political issue, and there must be a political will to do that.
Let's explore an issue you just touched on a short while ago. How do we reconcile the ethical obligation, if you will, to treat all individuals, regardless of nationality, with the financial strain this places on state resources?
Well, I can tell you our hospitals are really buckling at the moment. And our doctors have taken the Hippocratical oath, and our constitution prescribes, in terms of what we need to do. And I'd like to think that we all are constitutionalists and believe in our constitution and cannot err from that. And therefore, we do have to assist every person that walks through that door, in terms of emergencies. I mean, it is what we have to do. But, we can see the strain that hospitals are being placed under because of our severe budget cuts at the moment. And just to mention, I mean, the OHSC that is supposed to, make sure that all our hospitals are compliant and have got what they need to do in order to give quality health care and make sure that primary health is exercised as number one within our health care. They are just not able to do what they are mandated to do, because they themselves have got huge budget constraints and just don't have the capacity in order to assist, in order to make sure that hospitals actually comply in order to supply these services as well. So, it's a vicious circle at the moment that we're facing in healthcare, and very sad at the moment. And really, I think if we look at our medical legal claims and accruals in terms of healthcare, and if we can start getting rid of all that and cutting all the waste, then I think we can build on a far more professionalized healthcare to assist all patients with their healthcare needs.
Michelle, let's discuss the how. What steps do you propose for raising this issue within SADC, and how might regional cooperation help alleviate some of these challenges that we speak of?
Well, it would be up to the health minister and the president to do that, as that is their powers of negotiation with neighboring countries. And, certain discussions need to be brought to the table. And then obviously legislation needs to play a role in terms of enforcing what decisions were made during these negotiations. So it's really up to that body to make sure that we do that. I mean, if I go overseas and I land up in the hospital, I have to, if I travel, I must ensure I have medical insurance. Now, I'm fortunate that I'm able to do that, but not everybody, is able to have that kind of cover. But certainly, if doctors are referring patients from neighboring countries simply for health reasons, health treatment reasons, and patients are then returning to their neighboring countries, there must be some process that we can claim the cost of the treatment of that patient from our neighboring countries where patients have been sent to our hospitals.
But more broadly, what policies do you believe should be implemented regarding the treatment of undocumented foreign nationals to really ensure fair access to healthcare while also protecting state resources?
Well, I think the policy that we need to be looking at is, as I said before, it's making sure that we are able to recoup the costs that we incur. Because if a foreign national lands up at a state hospital for an emergency, you cannot turn that person away. You've got to treat that person. That is what we have to do. We cannot turn people away that need emergency medical treatment. I mean, that for me is totally unethical, and therefore there must be a change in the process in the way we go forward in claiming back treatment from our neighboring countries.
Michelle, thank you so much.
Brilliant. I think she has a really fair point. I mean, many times I really speak about to most of my audience on this channel. On this channel, if you really want to enjoy Kwazemi here, you have to really have an objective mind, okay? South Africa is a sovereign state. South Africa is a sovereign nation. Many times I actually also support the fact that some of the MPs, the likes of Gaten Mackenzie and some other MPs, really want to try to focus on South Africa and really help South Africans, make South Africans, kind of like comfortable. Many might argue that might be kind of like in line of the rise of populism at the moment with the likes of Donald Trump with America First, and now Gaten Mackenzie saying South Africa First and some other people. But at the end of the day, we see that these nations have been set up to cater for a group of people who claim sovereignty of that nation state or the borders of that nation. And so it would appear sort of like disingenuous to actually take from them that right that actually belongs to them to really enjoy their country, to really enjoy their sovereignty, express their citizenry, and really be proud of their citizenry in this regard. And so I think I see where this DAMP is actually coming from the perspective of the fact that there can't be foreigners coming in to get kind of like professional treatment in South Africa, and at the end of the day simply return back to their countries without that recoupment or sort of like finances staying within South Africa. I lived in the Nordics for many years, and even if you try to get into the Nordics to attain or kind of like get some healthcare from these Nordic states, for example, although this is kind of like a really extreme example because we're speaking about Africa when we speak of South Africa and the SADC region, maybe foreigners from the SADC region, for example, trying to get treatment in South Africa, all right? But in terms of this whole, even if most of these ministers go abroad, for example, there must be payment done, for the treatment really done in that country without kind of like claiming some form of solidarity or maybe partnership in that regard. No matter how much MOUs have been signed, memorandums of understanding, there has to be payment for service. And so I really see where this MP is going, and the DA's push for the fact that part of the budget constraints that South Africa is really suffering at the moment, especially in light of the soon rolling out of the NHI bill, which the ANC is really trying to push for. It might really be important to really now start creating this framework so that it wouldn't be like South Africa's budget is actually going to cater for outsiders, so to speak, without these budgetary structures put in place, so that even when the South African needs quality healthcare, there's still possibility for them to access healthcare. But I don't know what you guys think about it. But anyway, I really wanted to go through this story I found on the Daily Maverick. Really interesting and strange for me at the same time. So it speaks about a ghost company that actually bagged 428 million rand, as a tender for oxygen plants for state hospitals. But right now, it really appears that we don't know where that 428 million is at the moment. So it's actually an investigation by Daily Maverick, here, and it speaks about this Independent Development Trust. Okay, Independent Development Trust (IDT) was actually acting as a project manager for the Department of Health. This is Department of Health, which Aaron Motsoaledi has just taken over in this government of national unity. And it says that this Independent Development Trust, which was acting as a project manager for the Department of Health, appointed private contractors to install oxygen plants at 55 government hospitals, all right? And the project, which actually accrued to 836 million rand, raised similar red flags as the Digital Vibes fiasco. I think most of you know about that Digital Vibes scandal at the time, which the bulk of the spend was set to go to an obscure company which lacked required accreditation. So it appears that this current case now of the disappearance of this 428 million rand is sort of like similar to the almost disbursal of 836 million to an obscure company, which during this Digital Vibes scandal at the time, which appeared to have rocked South Africa at the time. But anyway, it says that there's the company here called Bulkeng Pty Limited, all right? And it says that it's something of a jack of all trades, and one of its entities that regularly submit bids for all manners of government tenders. So this Bulkeng Limited is one of those companies that actually submit bids for tenders to get contracts from the government and all. So it says that it submits bids for roadworks, for laundry equipment, mops and buckets, and a few that this Bulkeng Limited has actually tendered over the years. Now it also says that the company also fingers in other areas too, such as prospecting rights to mine iron ore, manganese, and limestone in the Northern Cape. All right. So now it says that after a tender process fraught with alleged irregularities, this company actually clinched a 428 million rand deal to install highly technical pressure swing adsorption oxygen plants at government hospitals all over South Africa. All right, it's a chemical process. Adsorption is actually different from absorption. So it's a chemical process, that accompanies this oxygen plant which South Africa's hospitals need. And this company, Bulkeng, actually, campaigned to get that tender. It says that this deal was actually signed off by Dr. Sandile Buthelezi, the Health Department's Director General at the time. So Buthelezi is actually now in hot water after News 24 found out this year that, there's an alleged kickback that was actually paid to him. So the alleged payment of 500,000 rand was reportedly made in connection with another project that the Independent Development Trust had managed on behalf of the Department of Health. The Department of Health's budget for oxygen plants rollout stands at 836 million rand. Okay, now, and this made up, this is made up of. It says that this is made up of this Bulkeng's, sort of like portfolio, but also there's a further 152 million rand that was set to be paid to another controversial contractor and its joint partner, which was which we'll be going into later. There was also additional professional fees, management fees, maintenance costs that was also included in the budget as explained by the Department of Health. All right. So the problem now is the fact that it says that there's the problem with these tenders now is the fact that there's really no accreditation on how these tenders really are embossed to this company. So it says that the foremost concern regarding Bulkeng's appointment relates to the company's accreditation as a supplier of medical products. All right, the bid document stipulates that contractors needed to be in South Africa. Contractors for these bids, they need to be registered with South Africa's Health Products Regulatory Authority, which is called SAPRA. All right, and initially the it says that the IDT was actually assured that Bulkeng had submitted a valid SAPRA certificate. However, SAPRA confirmed that Bulkeng was not listed on its database. So this is where the problem begins. It now says that Daily Maverick investigators now said that they started pushing for the Department of Health and the IDT for answers, leading to what was them a really strange turn of events. The Department of Health claimed that Bulkeng had partnered up with an entity called Brutus Atlas Copco Industrials South Africa, all right? And this entity holds the required accreditation, supposedly. Then they searched CIPC's database and couldn't find any company registered under that name, Brutus Atlas Copco Industrial South Africa. So it appears that it was an invention, so to speak, out of the blue. And, it then was supposed to be the one that was allegedly said to have the accreditation to supply this, this health equipment, according to the Department of Health. That, according to the Department of Health claimed that Bulkeng Limited partnered with this company, which is not really found now on the CIPC's database. But this company was the one that was acclaimed to have had the accreditation that Bulkeng didn't have. And so because of Bulkeng's partnership with this company, it kind of like provided some kind of legitimacy to be actually awarded the tender to supply these oxygen, facilities. But anyway, further, it now argues that, like a ghost, it says that over the course of several days to reach this Bulkeng sole director, it said that this director of this Bulkeng Limited continuously tried to evade the Daily Maverick investigators. Now, according to one of the company's records, it says that there was one Emmanuel Nkosinathi in Ndlovu who actually founded Bulkeng in 2010. It says that this company still doesn't have a website. The Daily Maverick investigators argued that they searched high and low and for physical offices of Bulkeng Limited, but they couldn't really find this Bulkeng as a company. It says that Bulkeng Limited doesn't appear to have telephone numbers listed anywhere, and that the CIPC record suggests that Bulkeng at one point actually had its office at Klerksdorp, all right, but the company no longer appears at the located address. It no longer appears to be located at that address. Now, this same CEO Ndlovu's link page, who is actually the supposed CEO of Bulkeng, his LinkedIn page says that the investigators here argue that this LinkedIn page reviews very little about the businessman, but says that he's based in Johannesburg. So, in summary, it says that for a business that is about to embark on a substantial, highly complex project, Bulkeng actually keeps a really perplexingly confusing low profile. And so this kind of like raised the red flag, according to these Daily Maverick investigators, and they really started to dig in deeper. They said that they managed to source a couple of cell phone numbers of Ndlovu, who's the alleged supposed CEO of Bulkeng, but he wouldn't take their calls and he wouldn't respond to their text or WhatsApp messages either. The investigators now started wondering if the Department of Health didn't perhaps share these concerns about the company and that, for this whole thing. And it says that the Department of Health said that the query can be directed to the IDT or Bulkeng to respond. So the Department of Health is trying to kind of like stay distant from this whole deeper investigation, and that, arguing that Bulkeng itself or the IDT, so to speak, actually have to respond to this allegation. So the Daily Maverick investigators continue further to really dig in, to really understand, this dichotomy, this really confusing, really strange, happenings around such a really large project to the tune of 28 million rand that is actually supposed to be disbursed as a tender to a company that is not really clearly accredited, but also not even easy to find, both in its LinkedIn page, in social media, even if it's in its physical addresses. There's no phone calls, there are no text messages, replies, and all that. And it really appears that money, might actually just be given to what the investigators here call a ghost company in South Africa. But anyway, it says that the report continues to say that the smaller portion of the rollout, which was worth 152 million rand, was actually awarded to a joint venture between Mazia General Trading and the On-Site Gas Systems International. But like Keng, now this same company which was supposed to get this health, bid, it says that Mazia does not possess SAPRA license as well, all right? And on-site gas system is, however, registered with the body. So it appears that these tenders sometimes are usually disbursed to some companies or contractors which do not have this SAPRA license. This is a license that in South Africa is actually stipulated, I think, according to law, that the contractors must have this SAPRA license before they can get bids, all right? But now these bids are actually given to contractors without a SAPRA license. But probably there can be a partnership. According to these investigators now, there's usually like a partnership where one company does not have a license and the other has a license. And so the contract comes to this partnership, so to speak. And at the end of the day, no one understands what eventually happens to that bid. And this kind of like brings me to what Rob Hersov, I'll be making a video on that. Rob Hersov speaks about how the ANC, he sees the ANC as a patronage network, right? So it's kind of like patronages given to people, members of the ANC for their performances. And so probably this kind of like explains how this patronage happens, where patronage might be given as a form of bid, so to speak. I really don't know. But anyway, this kind of like raises those questions. It also speaks about how this investigation goes on to say that when he was asked about his experience in the medical space, the CEO of this Mazia, his name is Chris Delport, he said, "Our company has diversified its portfolio to work in relation to the medical field. Our extensive experience in the construction industry has partnered with the expertise and experience on-site gas systems international and our partner, which is JV." And he says JV is best placed to deliver on this contract. So there's a partnership between this Mazia. Remember that it says that Mazia doesn't really possess a SAPRA license, all right? But the on-site gas systems is actually registered with the body, in charge to carry out these things. So this partnership then gives the Mazia the right to be able to sort of like leverage on the experience of on-site systems to carry out this. So this is how the whole tenderpreneurship for me works. And for me, I'm also really learning because it's really interesting. But anyway, it says that finally, in the sort of like the coming back to the oxygen plant delivery, which was supposed to be made for all I think would be most South African hospitals, so to speak. It says that in May this year, News 24 published details about this Mazia's past, all right? It says that after Mazia had been appointed to do some demolition work at the National Assembly, which was ravaged by fire in 2022, Mazia was fined by the Competition Commission for tender collusion relating with the City Power Project contract, all right? And it says that some of these Mazia's past government's projects were actually allegedly marred with significant cost overruns. So Mazia, the investigators actually argue that this Mazia as well has a really kind of like strange past, so to speak. But in terms of the ballooning, increasing costs of trying to, deliver oxygen plants to South Africa's hospital, with these investigators are probably, the overall read is that, what is being disbursed for these oxygen plants is too much, so to speak. And probably it could actually be done with less or maybe more effectively with what has been actually budgeted. It says that the budget for the oxygen plants, they rose dramatically after the IDT assumed ownership of the bid process. And it says that this has prompted further concerns among sources that are familiar with the development. It says initially the Department of Health performed a detailed cost analysis and determined that the rollout of this whole budget should cost roughly 256 million rand, which was a far cry from more than 800 million, which is now allocated to this project. All right. So initially, the Department of Health made a cost analysis, and that the budget for the supply of these oxygen plants was supposed to be 256 million rand. But now I think 800 million rand has been allocated to the project, and it argues that these investigators are arguing that they don't really understand. And it says that initial increase in cost then came after the IDT claimed ownership of the contract. So it says that the Department of Health and the IDT claimed that the much higher figure was brought on by price escalation. So price escalations of these oxygen plants then were the reasons why the budget went from 256 million to 800 million rand. All right. Now, this is an explanation from the Department of Health, which is, I think this is now currently headed by Dr. Aaron Motualedi. He says that the initial budget of 256 million rand excluded VAT, value added tax, and it was only for the construction of the oxygen plant. But it was also based on the 2019 estimate with escalation and COVID interruptions, and the value then increased, but also indicated value of 256 million excluded VAT, professional fees, management fees, and management costs over 36 months. So the reason why the budget for this oxygen plant now jumps from 256 million to 800 million is because it now includes VAT, it includes professional fees, it includes management fees, and then maintenance costs. All right. So that was kind of like what the Daily Maverick actually opened up about this. So it says that Daily Maverick actually has reliably established that the lower cost estimate was actually penned in late 2022, not before the COVID pandemic. So what is more is that Daily Maverick was made to understand that the 256 million figure was an all-inclusive budget that provided for maintenance over the period of 3 years. Yes. So anyway, this is the whole thing with the ghost company, which the investigators at Daily Maverick are called Bulkeng. That Bulkeng was a company that probably didn't have appropriate accreditation, didn't have probably appropriate SAPRA certificate, and also valid SAPRA certificate, and also most of the bids and the tenders given to companies that really lack this SAPRA certificate really has been brought to question by these investigators at the Daily Maverick to really kind of like explain and understand why most of these bids actually go to these companies without accreditation, and then probably explains why maybe, as I see many of you in the comments complain about some of these health facilities really breaking down and all that, because probably the companies do not understand what they're doing, and then probably increased budgets to them causes more and more siphoning of funds that should be budgeted for more effective purchasing of equipment and all that, but then it all goes to causes that probably might not benefit the wider South Africans at the long run. But anyway, this is what I thought it was a really interesting report by a ghost company and how the whole tenderpreneurship in South Africa works and all. But what do you guys think about this whole case with tenders and, tenders to less valid or less accredited companies, or companies that lack the accreditation certificates like this SAPRA certificate, taking bids for tenders and going on with those contracts in South Africa? Share your thoughts. Let's hear from you in the comments.